Hello, everyone. Welcome back to the Ask Dr. Be Good show, where we bring you information about what's going on in public education. Sometimes it's happening at Legacy, sometimes outside of Legacy, sometimes we bring people from the inside, sometimes we bring people from the outside, and just try to bring a lot of variety to you, our parents. One of the things that you know is happening next week is spring break. And so with spring break comes the opportunity to have a little bit more freedom, possibly go visit places that have a lot of people and who have the same plan as you, and that is to get out of the house and do something interesting now that school's out for the week. Well, so let's talk about being around other people and what's happening in the world today. There's something called the coronavirus. The coronavirus, which, by the way, we should be calling COVID-19. And I'll tell you a little bit more about that in a minute. But the coronavirus, or COVID-19, has been in the news and on our minds for several weeks now. I think it would be fair to say almost 2 months. And yet, instead of it going away, it seems to be getting bigger. We've had cases as close as San Antonio in Texas, and we've actually had some deaths in the Seattle, Washington area. What does that mean for us? Well, luckily for us so far, we haven't had any cases in Dallas, but you and I know that that could be something that changes any day now. So how do we prepare for the coronavirus? And more importantly, what do we know about the coronavirus? Why should we do this? So let me try to answer some of those questions. First of all, the coronavirus has actually been around. That term, that's a medical term that's been around for many, many years. You will actually find it not only on documents from your doctor, but you'll find it on the back of, for example, Lysol bottles. It says, will kill germs associated with the coronavirus. Is that the same coronavirus as what we're talking about from China? No. And so, first of all, let's make clear that the coronavirus is or has been known as the common cold virus. Some of you may not know that the coronavirus has been the medical term for the common cold for years. And so in that confusion, we have come to understand that we need to separate the two terms, because otherwise it can be scary. It can be scary to go to the doctor because your son or yourself has the sniffles, and then the nurse or the doctor tells you that you have the coronavirus. And you're like, what? When instead, you have the common cold. So let's make a pact that we're going to use, instead of using the coronavirus, you train your family and your friends to start using the term COVID-19. So that is an official term. It's a term for the actual type of coronavirus that we're dealing with from China. So, okay. So I'm going to try to be good and use just COVID-19. All right. So COVID-19 started, and I've got some things. I want to make sure that I bring you information that is real. Well, not that I wouldn't bring you information that is real, but information that's from factual medical places to share with you. So how did the outbreak start? The source of the coronavirus is believed to be a wet market in Wuhan. Now, we all know where Wuhan is, right? China, which sold both dead and live animals, including fish and birds. Such markets pose a heightened risk of viruses jumping from animals to humans because hygiene standards are difficult to maintain if live animals are being kept and butchered on site. Typically, they're also densely packed. That means there are lots of animals, live animals, close together, packed in crates, and can pass germs, viruses from one animal to the next. The animal source of the latest outbreak has not been identified, but the original host is thought to be bats. Bats were not sold at the Wuhan market, but may have infected live chickens or other animals sold there. So I know that I heard that. I heard that in the very beginning, and this is weeks ago, I heard that bats had infected snakes, had infected something at the market. So it's good to have some information now that we should feel is a little bit more researched about how this virus actually got from an animal to humans. And so what are the symptoms? Well, the symptoms are fever, dry cough, tiredness, and a general feeling of being unwell. Well, that sounds familiar, doesn't it? That sounds like the flu. So that's been part of the problem, is that many clinics and hospitals have not had the ability to test for COVID-19. And I don't know if you know this, but up to just 10 days ago, there was only a handful of places in the United States that could test for COVID-19. If a hospital suspected that a patient had the possibility of COVID-19, then they had to request permission to send that person to be tested. Since then, there are now 160 places, I believe I heard this morning, that can now test across the country for COVID-19. But you can see how this virus can be very easily misread as the flu or common cold, right? How many people have died from the disease so far? Well, more than 89,000 cases have been confirmed since the outbreak started, and the death toll has exceeded 3,000. The vast majority of cases are in China, but the virus has spread to 40 other countries. According to data from the Chinese authorities, around 80% of the cases of the disease are mild, but 20% require hospitalization. And some of you may be asking, is there a cure? Is there a cure for the coronavirus? Well, there's no specific treatment right now for the cure for the COVID-19. Although doctors are trialing existing drugs for viruses such as Ebola and H1V, early results seem promising, but until full clinical trials have been run, doctors can't be certain that the drugs are effective. And you can understand, and I'm sure some of you have heard that it takes almost a year just to get a shot, a coronavirus shot for this type of virus. So we're only in month 2.5, right? 3, because I believe we started hearing about it late December, maybe, and then we really start hearing about it more in January, February, and now here we are, very beginning of March, and this is when we're starting to get deaths now in other countries. So we're still in the early stages of this disease, and there's just been no time to get to clinical trials of testing drugs that might help against it. How is the coronavirus spread? And I'm reading coronavirus. They haven't started using the term COVID-19, but they will. Like cold and flu bugs, the virus is spread via droplets when a person coughs or sneezes. The droplets land on surfaces and are picked up on the hands of others and spread further. People catch the virus when they touch their infected hands to their mouth, nose, and eyes. It follows that the single most important thing that you can do to protect yourself is to keep your hands clean by washing them frequently with soap and water or hand sanitizing gel. For more information, you can go to different guides on the internet. You can go to the CDC website, the Center of Disease Control, and they update every couple of minutes on the spread of it, what they've learned works, better practices and so forth. But they do have here how the coronavirus spreads and how to protect yourself. The virus spreads in a similar way to flu or the common cold. In large droplets produced by coughs and sneezes, germs can live on surfaces for several hours. So that's one of the things that we at school are doing is we dropped off a huge shipment of wipes, Lysol wipes and disinfectants, hand sanitizers, and we've asked the campuses to wipe down tabletops, to wipe the door handles down frequently, to make sure kids are washing their hands after using the restroom, to train them in how to sneeze. And I'm going to give you all just a mini lesson, because I saw this in a classroom today, and it didn't happen the way it's supposed to. Even though I will tell you, I have asked every school every morning for the next few weeks to announce on announcements the reminder of how to sneeze. You sneeze into your elbow. Hopefully there's cloth there, or shoulder where there's cloth. So you sneeze into your cloth shirt so that the germs go into the material and not into the air. That's how anything spreads, really. The flu, the common cold. We've been trying to train kids to do this for many, many years, but now we have an even more urgent need to make sure that kids learn how to properly sneeze. I was in a classroom today, because some of you know I walk classrooms every week, and I saw a little boy sneeze, and he sneezed right into the air, and the teacher didn't do anything. And so we made a note to get with the teacher later and to ask her to please reinforce the correct sneezing protocol for our young people. The classroom teacher is really the front line to disease control. And so making sure our teachers take that very, very seriously is part of our work. And I'll tell you, I was in one of the best teachers that we have in the district. But she was so impassioned about her teaching and connecting with kids that she just didn't notice that a little boy had sneezed incorrectly. And so helping them understand that that's part of what they have to do to help us keep kids safe and healthy is just what we have to do. All right, so public health defines having close contact with a virus carrier as being within 2 meters. How much is 2 meters? That's 6 feet of a person for 15 minutes. So the thought is right now that COVID-19, it's a little bit of airborne, I guess you could say, up to 6 feet, and it can last in the air about 15 minutes. That's what we know so far. And I know I'm repeating myself, but hopefully over time you're hearing it enough and it'll become part of what you understand needs to be done in helping your family stay safe from it as well. For people who might have COVID-19, health officials are urging a catch it, bin it, kill it approach. In short, this means catching sneezes and coughs in tissues or in sleeves, throwing the tissues away, and then washing your hands. Why would washing your hands after catching your sneeze in your tissue be important? Well, because you had your tissue in your hand next to your face. So it's really important to help our young people understand, parents, that they're just not done with the tissue. They catch it, bin it, kill it, which is a sort of catchy slogan to help us catch the germs, bin it, which means catch the germs in the tissue or in the sleeve, throw the tissue away, bin it, right, put it in the bin, and that kills it, right, because it's in the garbage can, it's done. It can't hurt anyone else after that. Regular hand washing is considered the most important practice that one can use to reduce the chance of contamination from the virus lingering on surface. So I read this because I've been doing a lot of reading on the COVID-19, not only because I want to do whatever I can to inform the schools and keep them safe, but I have grandkids, I have family members, and as some of you know, my husband has had cancer twice, and so he's a little bit fragile. I want to make sure I can keep him as much away from bad germs as possible. And I read that there's a doctor, and it's probably not the only doctor, but in this particular case, a doctor who wears gloves when I think he lives up north where there are subways and so forth. He wears gloves all year round, and he uses those gloves because he doesn't want to pick up other people's viruses when he's on the subway, touching handles, touching the handlebars, touching anything that a lot of people touch. And that's something that you're going to have to learn to help your kids understand. For example, the handrails on staircases. In any building, whether a school or an office building, a store, right? They all have handrails if they have stairs. There's door handles to go in and out. All of those are touched by a lot of people. And so making sure that your kids understand that there's maybe a better way to approach door handles. Like, for example, I'll use my elbow. If it's a push-open door, I'll use my elbow to push it open so I don't have to touch the door handle. I'm the healthiest person I know, and that's one of the things that I do, out of many, but one of the things I do to try to not catch viruses that other people have left. All right, let's see. What else can we do? Practice everyday preventative actions now. Remind everyone in your household the importance of practicing everyday preventative actions that can help prevent the spread of respiratory illnesses. For example, avoid close contact with people who are sick. Now, moms and dads, I know that's a little bit hard for you if you've got a little one that's down, but you could really start thinking about, maybe I do wear those plastic gloves when I'm handling my little darling who's sick and got tissues and sneezing everywhere and so forth. Stay home when you're sick, except to get medical care. And that's one of those things that we're really having to pay attention to, not only at school, but also in office places where bosses are helped to understand that we don't want employees who are sick spreading their sickness at work. Nobody is that important that they have to come to work sick. If they have a fever, they need to stay home. And that goes for adults too. Cover your coughs and sneezes with a tissue or a cloth at your shoulder or your elbow. Clean surfaces that are frequently touched, and the other objects that are frequently touched, like tables and countertops, light switches, doorknobs, and cabinet handles. Using a regular household detergent and water is fine. If you have some Lysol, if you have wipes, that's fine too. But water and soap, which is what we're using on our hands, right, when we're washing, if it's good enough for our hands, it's good enough for our counters. It's not that you have to go out and purchase a lot of cleaning materials. It's just you have to get in the practice of cleaning with the materials you have more frequently, possibly. If the surfaces are dirty, they should be cleaned using a detergent and water prior to disinfection. And for disinfection, use a list of products that are allowed by the Environmental Protection Agency. We don't want to use things that aren't safe for the environment. So let's see. Wash your hands often with soap and water for at least 20 seconds. Now, here's something you can do. You can challenge your kids to be pretend doctors and nurses, because real doctors and nurses wash their hands for a minimum of 20 seconds. I've had family relatives who are nurses, and they mentioned that is a normal protocol for them. And so helping our kids be STEMmy, right? That's a STEM practice. They're practicing for being an RN or a doctor by washing their hands 20 seconds with soap and scrubbing under the nails, scrubbing between their fingers, and not just doing a quick scrub over the palm and the back of the hand and then you're done. No. So especially after going to the bathroom, before eating, after blowing your nose, after coughing or sneezing, and if soap and water are not readily available, use hand sanitizer that contains at least 60% alcohol. Always wash your hands with soap and water if your hands are visibly dirty. Let's talk about the hand sanitizer. I know at Legacy we've increased hand sanitizers. We've increased Lysol cleansing with wipes of tabletops, of door handles, and so forth. But let me remind you, yes, during this time period when we need to keep the virus from spreading, hand sanitizers are good, but they're also very drying for our hands and our little ones' hands. So it would not be a bad practice every night before they go to bed to have a nice moisturizer that you put on their hands to counterbalance all that heavy alcohol sanitizer that you're putting on their hands. It's very drying, and it'll crack around their fingernails and so forth. So do a practice of also moisturizing their hands and their faces when they go to bed. And here's something interesting that if you haven't already done it, you might think up a family plan of when a family member gets sick. Now, we're not saying with the COVID-19, but with the flu or the common cold, you choose a room in your house that can be used to separate the sick household members from those who are healthy. Identify a separate bedroom for sick people to use if possible. Plan to clean those rooms as needed when someone is sick. So have a plan of action ready for those who might get sick. And again, not necessarily of COVID-19. I'm going to be optimistic and say that in the Dallas area, we're going to not necessarily see a lot of our community get COVID-19. But interestingly enough, as scary as COVID-19 sounds, the flu kills many more every year. Now, COVID-19 is a little bit more infectious. You can catch it easier than the flu, but the flu is more prevalent. So a lot of practically everything that I'm saying, you can apply to keeping your family safe from flu as well. And from what I've been reading, by the way, here's some good news. It doesn't seem like kids catch the COVID-19 as quickly as especially older folks or those with compromised immune systems. Now, what does that mean, compromised immune system? Compromised immune systems are those people who have a sickness, whether it's hypertension, diabetes, some kind of infection. Those are people that, because their immune system is compromised, i.e. their systems are not in top shape, they're more apt to catch an infection than those who are healthier. And so those that are at risk are our older folks that tend not to be as healthy, and then sick people. Masks. Let's talk about masks for a minute. A lot of you are starting to see people, or maybe some of you are even wearing masks when you go out. Here's good news, bad news. The good news about masks, if you're the sick one, is that if you're wearing a mask, you won't infect people because your germs are being kept inside with you because of the mask. If you're a healthy person and you're wearing a mask to not get infected, that won't help you. Matter of fact, I've actually heard doctors say that healthy people wearing a mask can actually end up getting sick because of it. Now you're saying, what does that mean? How's that happen? Well, the way that happens is the mask is on your face. It makes you hot. You've got all that humid air from your nose and mouth coming around your face. And guess what your hands are doing? You're going up under the mask and you're touching your nose and your face and your mouth. Fingers that have probably touched other places that could be infected that other people have touched. So the only people that really should be wearing masks are people who are already sick. Unfortunately, similar to the flu, most people who have COVID-19 in the beginning don't know it. They don't know that they're infectious. They don't have a fever, but they have it. And so it'll be a few days before it plays out, before the symptoms start. By that time, they've already infected others. So having said all of this, I hope that at least COVID-19 is better understood by all of you, that you'll share this information with family and friends, and that you will put into practice these health practices that the CDC has asked us to do. We did send a letter home last week. We have asked the campuses to read every day on announcements the health practices that we need our young people and our adults in the buildings to practice. That is, again, coughing into a sleeve, coughing into a Kleenex, throwing it away, washing their hands frequently, 20 seconds, all of that. We remind them every day. And so now we're adding you, parents, to the fight, the health fight that we have on our hands and keeping our young people and yourselves healthier. So I have just a few minutes to talk about some of the other things that I would like for you to do on the next week while you're on spring break. First of all, most of the grade levels are sending home homework. Now, homework is not going to be a lot because we do want kids to have some relaxation time, but we are sending some spring packets home for kids to stay focused on the work. You know, the first testing for STAR for 4, 5, 7, 8. 4, 7 writing, 5, 8 reading and math happens the first week in April. And so that's a month away. We don't have much time to just make sure our young people show their best and do their best on the STAR test. And so we're sending some things home to keep the spring slide from happening. You've heard me talk about the summer slide. Well, we don't want the spring slide either for them to have any learning loss during the week. So we do have some packets being sent home in the elementary grades. We also have the reminder of, and this is not just for spring break, but this should be happening all year, every weekend, and that is we have math and reading software that the kids can do. And I hope that we have made these software so entertaining that it's not really a hardship for the kids to use it. We're asking them to play a reading game or a math game for 30 minutes once each during the weekends. And I hope that you will join us in helping them do that. In essence, they're learning about while playing. And so if you're not sure they have their passwords and IDs for these softwares, please ask them. Every grade, I believe, has softwares that they can be doing. And again, let me mention, the software companies make these games as entertaining as possible for kids. This is not it's not like taking a STAR test on the weekends for 30 minutes, okay? It is asking them to learn by playing. So you might ask the kids to show you their math and reading softwares and see if they're a little bit more entertaining than what you remember from your SRA days. Do you remember SRA? That was a reading intervention program where you went and if you were different level colors and then you went and picked the book out. Anyway, that was boring. And so we want to make things a little bit more entertaining for kids while they learn. So what else do we want to talk about? We want to talk about keeping brains sharp by doing things like making sure they're reading books. Take them to the library. Take them to the park and have them talk to you about erosion. And is spring coming? Have them tell you, can you tell spring is coming? Can you look at the plants and which plants are telling us that spring is coming? What's happening to some of our plants that is different than a month ago? Become scientists out in the environment. Go to museums. If you can go to the Puro Museum, oh my gosh, that's entertainment for the whole family. There's just so many events. And because I only have 1 minute left, let me mention, go to the website for your city, the Dallas City of Dallas website, the City of Mesquite website, the City of Plano website, and look at their calendar of events. There are so many things that are happening that are entertaining and free in many cases. lectures by very famous people, interesting people at libraries at night. Make sure that you and your kids, matter of fact, ask your kids to look it up. That would be part of their, a good way of getting kids to use the internet correctly. But make sure that you use the resources of the cities to bring value to your family. As always, I always go into these podcasts thinking I won't have enough to talk about, and then I run out of time. I hope that this has been an entertaining use of your time in a way that will bring some safety practices to your family, some good ideas from what to do next week for spring break. And yes, there will still be a podcast next week. We're pre-taping it, and it's going to be very interesting about the use of AR in classrooms and classrooms of the future and what that looks like. So I hope that that will entice you enough to want to, if not listen to it on Tuesday at 3 o'clock next week, to listen to it afterwards. All right, everyone, have a good spring break.
Thank you for tuning in to the Ask Dr. Be Good show. For more information on Legacy Preparatory Charter Schools, visit our website, legacypca.com, or call 469-249-1099. And remember to like us on Facebook, where we stream live weekly Tuesdays at 3 p.m.